RACPARC stands for Regional Climate Change Vulnerabilities and Regional Climate Adaptation Plan. This is a project that started in 2019. The project currently includes 13 of the 18 public health directorates in Quebec and more than 60 public health professionals. We currently cover more than half of the territory in the province of Quebec and more than 75% of its population. The main objective of the project is for each public health directorate to assess its population's vulnerability to climate change on its scale, its regional scale, so that it can design a regional public health climate adaptation plan. We also aim to promote linkages between regional public health authorities and regional stakeholders, including municipalities and community organizations, in order to pool expertise and avoid duplication of effort. It is also clear that one of the objectives is to enhance, in a way, public health's role regarding adaptation to climate change and to include the health perspective more in the adaptation measures that will be implemented. So at present, there are already several government and research community stakeholders involved in the project. These include the URNOS Consortium, the University of Quebec at Rimouski, and even several government ministries, including the Ministry of Health, the Ministry of the Environment, and the Ministry of Municipal Affairs. Also, at the regional level, there are more than 30 municipal stakeholders that have already collaborated with public health directorates on the project. We've experienced some challenges, mainly arriving at a consistent public health position by considering vastly different hazards, such as Lyme disease, coastal erosion, and heat waves, which have different impacts at different times and spatial scales, and also for which the quality of the data is not the same. Sometimes we didn't even have any background or very little for these hazards.
Regarding the challenges encountered in the VRAC-PARC project, we can mainly talk about the coordination of the project itself. It takes someone to coordinate the entire project, or at least a full-time resource who is really dedicated to the project, who can fully invest in it, make connections with the partners, and move it forward. On our side, we had a few interns who participated in the project, which made it so that there was little turnover. Well, we're at the stage where we have to bring it all together and put the pieces back together to continue the project. In terms of challenges, we can also talk about appropriating climate data. It's not obvious for everyone. We're not all experts in these climate models. We can also talk about expertise in geomatics. When you want to do mapping to identify vulnerabilities on the territory, you really need people who are skilled with these concepts.
So putting all this together was a challenge. However, we also experienced it as an opportunity in the region because it forced us to take a broad public health angle to really try to see the interconnections between climate change and all the other determining health factors, and then to also highlight the co-benefits. This is something we are developing that will serve us for a very long time. This complete public health position, even if it is not equal for all hazards, and we do not have the same level of precision or clarity for each one, is really appreciated by our partners. They like the wide angle that we bring, and it meets a need that they had. So overall, we are very happy with the exercise, despite its challenges. It has been really interesting to do, and will be interesting to continue.
So for us in the region, the project was really well received by internal and external partners, all during a pandemic. It allowed us in public health to present ourselves outside of the context of COVID, and also allowed us internally to work on a file that was also different, to give ourselves perspective and to be able to project ourselves into the future. So that was a positive. It allowed us to develop our skills in cooperation and mobilization, as well as the whole appropriation of knowledge and skills at the level of the various climate databases, and then to be able to transfer knowledge. We went on to consultations and then arrived with descriptions that were works in progress, but for which we could already present the results. This allowed us to disseminate the information, which is very extensive and complex, so it allowed us to make it a little more digestible. It also allowed the participants to identify the stakeholders. Then, when we surveyed the participants afterwards, we saw in the feedback that it met a need we had expected. It was expected that public health would have an initiative like this. They were also looking forward to the next step, so naturally it leads us to PARC. The project's main successes, we can talk about partner involvement, colleague involvement. People really want to get involved. They want to move this great project forward. There's also the advantage of it being coordinated provincially. This allows us to share our experiences with other regions, to share our successes. It's really interesting to see what's being done in other regions. Vulnerability assessment is a process that is extremely motivating and essential, but it's also something that can quickly become complex because of the large number of factors under consideration. It's important to know that an approach is not necessarily more complete or useful to your partners if it's cumbersome or overloaded with information. So we really need to focus on the expertise we can bring to our partners and communicate that expertise in a way that will bring the stakeholders into action. That being said, for many stakeholders, climate change adaptation is mainly related to environmental and infrastructure aspects. We noted that the health and population aspects of climate change are less known. Cities are therefore sometimes involved in adaptation efforts, but knowing which population is where, what hazards they're vulnerable to, and how to improve their resilience are all elements that are generally less well known. So that's really where it's actually a great opportunity for health authorities to address the adaptation and vulnerability from a population perspective. This not only creates an awareness of the impacts of climate change on health, but also responds to a need for information that is not necessarily provided by other partners. Among the advice we'd like to share with organizations that are engaged in the analysis of vulnerability of populations to climate change. First of all, we encourage you to set aside time for the project, despite the priorities, all the priorities, to be able to maintain momentum and devote a stable resource person, such as a full-time project manager, who will allow the project to move forward and ensure continuity of the work and maintain a link with the partners. A second piece of advice would be to think about quickly initiating approaches with partners to learn about their initiatives, the work that is underway, and the concerns they have in the context of climate change. Collaborative work allows for the development of information and tools that are concrete and adapted to the partner's needs and do not focus on theoretical foundations, for example. We could, among other things, develop tools, tables, and an information bank that is really intended to popularize their reality. A final piece of advice would be to provide organizations with a vulnerability reading, which is the mission of public health, to allow municipalities to develop a health reflex on the understanding of the vulnerability of populations, particularly vulnerable populations, because, as we know, they're the ones that will ultimately be much more impacted and much more affected by climate change.
For the project's follow-up, funding from Health Canada allowed us to receive additional funding from the Quebec government through the Fonds d'électrification et de changement climatique. Currently, the VRAC Park project is part of the 2021-2026 implementation plan for the Quebec Plan for a Green Economy. The project is expected to continue for several more years. Several actions are planned for these years. In particular, each public health directorate will vitalize its regional vulnerability assessment, will intensify its linkages and collaboration activities with regional stakeholders, and will develop a climate change health adaptation plan. This plan will also lead to concrete actions that will definitely have to be implemented in collaboration with regional stakeholders. We think of the municipality, given that public health does not have all the powers to literally implement these various measures. Over time, we also want to integrate the public health directorates that are not yet part of the project in order to cover the territory in Quebec. So that's what's in store for us over the next 4 years.